If you are waiting to have ACL surgery and you want to improve your chances of success post-surgery, then this video is for you. And if you just take home one key point from this video, you'll be doing better than 90% of the people in my Instagram DMs that sit and guess their way through prehab and post-surgery rehab. In this video, I'm going to tell you exactly what you need to do pre-surgery to improve your outcome post-surgery. But first, please allow me to address the elephant in the room. That is the level of messages that I get on social media, via email, however other people choose to interact with me, what to do pre-surgery. And I'm really struggling here because some people will message me and imagine that I've got some kind of crystal ball. I don't. I'm insured. I cannot give out medical advice in Instagram, DMs, WhatsApp, when you are not my patient. So let's try to clear up some of the missed things that people do before getting surgery. The number one thing people do ahead of getting ACL surgery is nothing. Yeah, you heard that. Nothing, diddly. They do nothing. They don't even attempt to do prehab. What's the point? My knee's wrecked already. Those are the type of things that I see in ACL recovery hubs, which don't get me started on why I don't think they're for everybody and why I actually advise my own patients not to join them. But so many people think that they're just doing nothing. Just do nothing, may as well wait. My knee's wrecked already, right? No, if you want to improve your chances of having a better success rate after ACL surgery, you need to start prehab. And particularly now, also, I give all of this information away in my ACL guide as well. Studies now show us that if we do your 5 rep max testing, quadriceps, hamstrings, glutes, etc., you will have a better outcome and have a much safer return to sport. So even in my ACL guide, it teaches you and tells you how to take those measurements ahead of starting your surgery. So basic measurements are an absolute must at improving your chances post-surgery for a better safety return to sport. That felt like a huge mouthful to get out. Okay, you are here because you have just ruptured your ACL and hopefully I'm catching you right at the start. I'm very sorry to hear that's happened. It tears your world apart, I get it, but you're in the right place. The key things I need you to do, and this is where people get so confused with prehab, is get your knee straight, bend your knee, reduce the swelling, elevation, start to walk normally. That's it. That is it, okay? Now, before people start jumping into the comments and saying, what about cross bracing? Don't get the knee straight if you want to cross brace. If you want to cross brace your knee, i.e. don't have surgery and wear a knee brace for 12 weeks of your life, you need to get an MRI scan within a week of that injury happening. You need to see a sports medicine doctor and you need to have very, very, very careful and regimented care throughout that whole procedure to prevent things like DVTs, which do happen, and you also have to be fully aware of the risk. So if you're not going down that road, get your knee straight, trust me. Then, once you've got the knee straight, started bending it, walking normally, reduce your swelling, you just start to load in any way that your knee will allow you. Some people say, but Tilly, I don't want to get the guide, I don't want to work with you yet, because I've got a meniscus tear. So what? So have hundreds of other people and they don't even know they have a meniscus tear. Having a meniscus tear doesn't stop you doing prehab. If anything, it's going to make that meniscus tear better. Things you want to avoid is things like deep squatting, jumping, twisting, pivoting. But getting your knee stronger before surgery is going to decrease the risk of further injury to your knee because you will have less giving way episodes when your knee is strong, okay? Not only does prehab set you up to go into better surgery, if you work with a proper clinician or get something like the ACL Recovery Guide, it is also going to tell you not to sleep with a pillow under your knee. So many people make that mistake. I know, if that's you, get it whipped out. Why, Tilly? Why can't I sleep with my pillow under my knee? I've just ruptured my ACL. Give me a break. Because you are putting your knee in a flexed position. Your quadriceps are fast asleep. The quicker you get your knee straight, the quicker these quads start working, the quicker you can walk around like normal, okay? Summary, when do you start prehab? ASAP. When do you start rehab after ACL surgery? The minute your eyes were open post-surgery, ASAP. What does it look like? Progressive overload, do the basics first. It's not sexy, it's basics. Get your knee straight, reduce swelling, start to walk normally, load your knee as tolerated, okay? It's literally that simple. Pre-surgery and post-surgery rehab for the first 6 weeks are very, very similar. Some considerations to take into account is if you've got a meniscus tear, like I said, don't squat below 90 degrees, avoid twisting, pivoting, which you should be doing anyway if you have tore your ACL. I really hope that clears this up for you. It cannot get any simpler or any more straightforward than that. So many people overthink it. A lady messaged me recently and said, what do I do pre-surgery? Does your guide include prehab? I might just wait and get your guide after I've had surgery. And I was like, you're going to make the number one mistake that most people make, join the club and be totally unprepared. If you're about to have surgery, why not go and watch my video on who I think shouldn't get surgery or why you perhaps shouldn't get ACL surgery. If you've enjoyed this video, please like and subscribe because it tells me to keep turning up and to keep making them. Catch you in the next one.